Hello, friends. This is the ninth edition of What the Facts, the most frequently asked questions about nutrition. I'm going to start by suggesting again, do not use anything I say as medical advice. This is not a prescriptive presentation. Don't make any changes in your medications or sweeping changes in your diet or lifestyle based on anything I tell you before consulting your doctor. Okay, I decided to talk about irritable bowel syndrome this week. Did you know this that April was Irritable Bowel Syndrome Awareness Month? Somebody reminded me of this a couple of weeks ago, and so I decided I would post this video. So, what is irritable bowel syndrome? It certainly sounds like something we all have experienced at some point in our lives. But this is actually a disorder that can be devastating to people and has a prevalence of about 10 to 15% in this country, meaning about at any given time, there's about 10 to 15% of people suffering from this. Now, the symptoms of it include abdominal discomfort or pain, bloating, constipation, it can be diarrhea, um, occasionally the passage of mucus from the stool in the stool. And these things tend to occur unpredictably, sporadically, and can be pretty distressing for people. That's the difference between just some mild indigestion and irritable bowel syndrome. Now, the um, cause of it isn't really completely known. The thinking is that it has something to do with um, perhaps the nerves in some people in terms of that nerve networking between the brain and the gut. And we know there's a network because what happens if we get really frightened or terrorized? Our gut wound, and we get this churning in our gut, and you know, under extreme conditions, we can have nausea and vomiting when we're really upset, as well as when we're just a little nervous, even from a test we're going to get or a test we're going to take. We tend to get those butterflies in the stomach. That has to do with that nerve networking. Other things that occur is the muscle that's surrounding the gut, the small intestines and the large intestines, mostly in this case, the large intestines, that is dysfunctional, contracting too long or too vigorously. There are these strips of smooth muscle that, like in a spiral, surround our intestines, and that allows for the motility, for the movement of our food and waste that comes from it down the line. But if it's not coordinated and working well, you can get this irritable bowel syndrome, which I refer to as IBS here. Other causes can be bacterial infection, something called gastroenteritis. It may follow that either from a virus or a bacteria. Sometimes the treatment of it with an antibiotic, although there's some other special disorders that can occur from antibiotic disruption. And then it can be from something near and dear to my heart, from disruption of the gut microbiome. If you look in nutrition science literature, that's a large reason. That's a common, I should say, common reason for irritable bowel syndrome, because it makes sense. We eat multiple times a day, and it would make sense that when we eat certain things, it may disrupt the chemistry of the bowel and how it relates to its functional activity. So those are some of the more common causes. There also can be childhood stress has sometimes been associated with it. Now, how do you work it up? How is it diagnosed? It's kind of a diagnosis by default. Your doctor will first do a thorough history and physical, and that's usually followed by some tests, maybe blood tests and X-rays, CT scans. You may get referred to a GI doctor to have endoscopy, where they look into your colonoscopy, or upper endoscopy. But a lot of these things are often done to rule out other causes like celiac disease or inflammatory bowel disease, which has two subcategories, Crohn's and ulcerative colitis, the latter of which, the ulcerative colitis, is often associated with rectal bleeding. And both of these inflammatory bowel diseases are associated with outside of the GI tract problems, like involving the skin, the joints, sometimes the eyes, and you don't see that with irritable bowel syndrome. So once doctors are able to rule those other entities out, then by exclusion we're left with irritable bowel syndrome. There's not a direct test at this point for it. It may have a familial connection, which means it may have a genetic connection. Like most complex diseases, it can be genetics versus environment, or rather genetics and environment. And there's nothing we can do about our genes, right? We can't go back in time and change our parents. Most of us would not want to. But what we can do is we can change what we eat and eat more healthy and try to reduce foods that might trigger this or cause this. And so that's usually the step to take, is to first get your workup from your doctor and see to it that there's nothing else going on, and then go along with the treatment plan. Now, I'm more for the non-medicinal approaches, and I think probably most doctors are too, but that would involve changing your diet, or at least first thing, keeping a food diary to see what might be triggering it. There are some food triggers that can cause this type of disruption for people. Like some people may have this aggravated by consuming dairy products, cow's milk, and anything that's made with milk, baked good, cheese, sour cream, things like that. And if you eliminate these, you might find over the course of a month that you're no longer having these GI symptoms, these gastrointestinal symptoms. Sometimes it can be brought on or triggered by cabbage or by beans or by certain grains or carbonated beverages. And so I kind of go over these things with people. Some people even ascribe these symptoms to when they eat onions. And so certainly if we can just reduce or eliminate a particular food group, we can sometimes conquer this problem, or at least make it better. There are also ways of approaching this in terms of looking at things you're drinking. Like I said, the carbonated beverages, they tend to cause more gassy distension, so you want to back off those. And certainly processed foods that have over 10,000 chemicals in it, often many of them regarded as something called GRAS or GRAS, generally regarded as safe. That means they haven't really been studied. And so the less processed food, in my opinion, the less unhealthy your gut. So these are things to work with your doctor on, and to think about. There's not usually a surgical approach to irritable bowel syndrome. And sometimes there is for the inflammatory bowel diseases. So that's another separating feature. Irritable bowel syndrome happens more often in people under 50, and more often in females. But I think that female connection is not so great in terms of the fact that I think females more often present to doctors and for problems and are more health conscious. Males, unfortunately, tend to often wait until stuff is falling off their body before they go to the doctor. So that may be one reason why there's that influence. At any rate, the bottom line is to get the workup to certify the diagnosis, and then seek out whatever measures you need from your doctor to address it, and consider a dietitian or some dietary consultation to see how you can approach that with eliminating or reducing certain foods. Like I said, consider eliminating dairy right off, because that's low-hanging fruit, so to speak. And so that would be a way to deal with that. I hope this video was helpful. If you like this video, please hit that like button at the bottom, and certainly subscribe to the channel. Check out my website, which is hooked with my Instagram account. That's www.fearlessmd21.com. And look out for the next video next week. It's been a pleasure. My quote for the week is from, I'm going to mispronounce the name, Pooja Model is the name. Healthy eating isn't about just counting fat grams and going through cleanses and taking antioxidants. It's about being selective about what you eat, about eating food that is the least tarnished, the least tainted in a balanced way. All right. Thank you and see you next week. Bye.